This is Charles. I'm one of the surgeons at Southpaws. This was a 6-month-old Kelpie that presented with a history of a left forelimb lameness. It was exacerbated by jumping up on the owner one day and then has persisted since then, intermittently responsive to anti-inflammatory medications. And on physical examination, it was very sore in the left shoulder. And so immediately we think about, in a young dog, we think about developmental diseases like elbow dysplasia, panosteitis, OCD, things like that. And then the fact that it was painful in the shoulder made us think about an OCD lesion. And so if we look at the two humeral heads here, that one is the normal one. When we look at the abnormal one, you can see the big divot in the subchondral bone there on the left caudal humeral head. And so this is classic for OCD. So I'll just do a 3D multiplanar reconstruction. And we will come over here. And then when we look at that caudal humeral head, I'll just spin this around here. We can see that big defect back there right on that caudal humeral head, which is consistent with osteochondritis dissecans. So big defect right there on that on that caudal humeral head. So now I'll come back out here, go into our soft tissue scan, and then do a 3D surface rendering or volume rendering. Okay, so that's our left side there, and we'll just get rid of the muscle, enlarge that, and you can see that lesion on the caudal humeral head so clearly there. So that's just a classic OCD lesion. When we look at the other humeral head, we see it's completely smooth. Back over to the affected leg and big divot back there. So our plan is to do arthroscopy today and go in there and retrieve that cartilage flap, and we'll also debride that subchondral bone. So I'm not going to live stream it today because I don't have consent from the owners, but I'll might give you guys a follow-up later on. So thanks a lot for watching. Question, what kind of CT do we have? We have a Canon 16 slice or Toshiba 16 slice machine here in Moorabbin, and it's about probably 3 years old. And then we've got a 2-year-old Siemens 64 slice in Mornington. Anyway, thanks a lot for watching, and we will see you again soon.